This is episode 527 of the Rio Grande Foundation's Tipping Point, New Mexico. I'm Paul Gessing. I'm president of the Rio Grande Foundation, New Mexico's free market think tank. You can find out more about the foundation at riograndefoundation.org. I am very pleased to be joined by Dr. Deane Waldman. He's a former board member of the Rio Grande Foundation. He is also a former distinguished senior fellow on healthcare policy at the Texas Public Policy Foundation, our sister think tank in Texas. And Dr. Deane Waldman runs runs one website that I know of, DeaneWaldman.com, in which he posts a lot of writing and information about healthcare policy. Welcome back to Tipping Point, New Mexico, Deane.
Glad to be here. Thank you.
Yeah, and astute observers of this show may recall that we sat down in person. I forget at what stage of the whole COVID pandemic was, but it was one of our only shows that got dinged by YouTube and pulled down by YouTube. But it was definitely during the COVID pandemic, and you were here in studio. You are no longer a resident, and we'll talk about healthcare plenty on this conversation, but you are now a resident of Texas, having done work for the Texas Public Policy Foundation. Talk briefly about where you are in Texas and what your impressions are of Texas versus your former life in Albuquerque, New Mexico, and what's different about Texas?
It really is a difference. I live, strictly speaking, in Austin, the very north end of it. So I'm also in this area called Round Rock. Very nice area. The most striking thing for those who come from New Mexico is all the trees and the green, which of course means that Texas has water and New Mexico has little thereof. But you want to know my impressions of difference. And the striking thing to me is that New Mexico seemed to constantly be dealing with problems and unable to fix them, whatever the problems are, whether they were financial, as in economic, whether they were healthcare issues, whether they were policy issues regarding the environment. It was kind of a negative feeling, like we're always in reactive mode, catching up. Gee, we can't get ahead, sort of thing. And in Texas, it's really the exact opposite. Everybody is, not everybody, but most people are very positive. Driving on the road, there isn't road rage, anger. There is courtesy. The service people that I interact with, whether it's in a restaurant or Starbucks or wherever, I prefer local coffee shops just to support local. They're all glad you're here and smiling and so forth. It's just an up, if you will, feeling, as opposed to a more depressed feeling that I got in New Mexico.
Yeah, and you were in New Mexico. Describe your professional career in New Mexico, because you have a long pedigree of involvement and directly in healthcare.
Well, the short version is I was at the University of New Mexico hospitals. I was the chief of pediatric cardiology. I take care of children, not adults. I miss the kids, I must admit, because I retired from clinical practice. The important point to note there is that for close to 50 years, because prior to that I was at the University of Chicago, close to 50 years I was a practicing physician, in contrast to, forgive me, people like Fauci and Walensky and these people that made all these pronouncements and mandates during COVID, but those people literally never took care of a patient. I had to work within the system the way almost a million other physicians have to work within the system. And so when I speak about the issues of trying to get care to the patients, this is not from some high level policy think tank. It is from the ground of trying to do the best you can for a patient. And I think that's what I want your listeners to hear when we get into the policy issues and I start talking about the problems of trying to actually care for sick people, sick patients, whether children or adults, doesn't matter. And the fact that the system gets in your way of trying to help people rather than helps you help others.
Yeah. Before we completely move on from the Texas versus New Mexico thing,
Sure.
I should let listeners know that I recently visited Texas on a family vacation and drove extensively through Texas and wrote an article about it that appeared in the Sunday Albuquerque Journal. And Deane, I will say that if you talk up Texas, anything nice about Texas to New Mexicans, it is a good way to start a debate or nay, an argument even, because, journal columns that I write sometimes generate one or two emails. I got a few dozen, about 3 dozen comments, often hostile, sometimes positive, but it is a great way to start an argument here in New Mexico. I'm not sure if it's the same in Texas. If you mention New Mexico, well, I'll defer to you. When you tell people that you moved from New Mexico, do you get a reaction from people in Texas?
Not really. There's not the sort of level of hostility that in that direction that there is in the other direction. And I find it really depressing because, I mean, if you think about, for example, oil and gas, I mean, New Mexico had an economy that was 40% of its total revenue was from oil and gas, and yet the sort of woke movement, if you will, suppressed and tried to shut down our great resource and the use of that resource. My point is that Texas, in a very real sense, was built. Its economic foundation was built on the oil industry. And right next door, there is this other place called New Mexico that has a huge amount of this resource. And we, New Mexico, should be applauding and using and getting all the jobs, et cetera, from this industry that we need.
Yeah. All right. Well, let's move on a little bit to healthcare now. One of the things I definitely wanted to discuss with you is, I think we're sufficiently beyond COVID at this point to call the pandemic over. And, even the Biden administration said that a few months ago, but let's talk in broad terms about kind of the credibility of the American medical system now post-COVID. I think a lot of people feel that they were sold a bill of goods, that the information that they were told by government officials was not accurate, or there was a lot of manipulation going on. I'm assuming you agree with that, but talk a little bit about that, and then how do we move forward in American healthcare more broadly?
All right. The first part of that question is, I have to say, I think you were being kind when you said what you said, because the fact is, this was the big con. This was a scam, and it was done under the guise of a person who has, or several who have MD after their names, And I give them not only no credit, I give them a huge amount of blame because they were on a power trip. Now, to make the specific, what we're talking about evidence, the fact is the vaccines that they mandated will go backwards. The vaccines that they mandated were not tested properly. In fact, there's now evidence that they weren't tested successfully at all before they got mandated for the entire population. That is literally unheard of. No physician in his right mind would ever say, hey, I'm going to give everybody this vaccine, but I don't know any long-term outcome results, any moderate term outcome results. And by the way, I'm not sure it works. And oh, by the way, it is genetic therapy. It is not a vaccine in the usual sense of mumps, measles, polio. It is not that. It is literally gene therapy. And the websites of both Pfizer and Moderna say that. So my point is, they forced us to do, we the people, they forced us to do something that was unnecessary. If you look at the actual risk factors, you find, for example, for children, the risk of the vaccine is greater than the risk of the disease. Now, that sounds like a crazy statement, except that the data proves what I just said is true. Then we get to things like lockdowns and something like 200 and whatever thousand small businesses were closed permanently as a result of the social distancing, the lockdowns. And these are all people who had livelihoods that had their livelihoods taken away from them. There are now articles coming out of people who, because of the delay in diagnosis of their cancer or their heart disease, literally died by what I call death by queuing, which is they were waiting to get their care, but they couldn't get it because the system was overwhelmed with patients fearing they had this disease called COVID that got, there was an article early in the pandemic that compared COVID to the bubonic plague. Yet the fact is that if you are a healthy, we won't discuss children who should never have gotten vaccinated. If you're a healthy adult and you don't have diabetes or other very serious life-threatening comorbid condition, you are at no more risk for COVID, of dying from COVID, than you are from the flu. Yet they pose this thing as an existential threat. So what does the American people do now that we're seeing these results, all these side effects, low sperm counts in men who have been vaccinated, menstrual cycles that are being altered in women who have been vaccinated? We don't know what effect this is going to have on babies in the future, much less, children in the future. So we, the American people, are going, wait a minute. Now the guys that were suppressed, me included, by the way, you were taken off, the podcast was taken off, so were several of my podcasts that simply questioned the narrative that was coming out of Washington about the dangers of this disease and the risks associated with the vaccination, rather than the risks, in addition to the risk, low risk of the disease. So the American people are going, wait a minute. The Biden administration and these people like the CDC, NIH, and FDA all said they were following the science, but what they were doing was suppressing science that they didn't like. People who were simply questioning the disease, where it came from, whether it was from the Wuhan lab or not. I don't need to tell you, there were a whole host of articles that were literally censored before they got out into the public domain or our medical domain, because it didn't fit the Washington narrative. So the people in our country are now sitting going, why should I trust the CDC? The CDC just came out with a recommendation for remdesivir, yet they still, by the way, which is both dangerous and has not been proven to be effective against COVID, and yet they haven't withdrawn the prohibition on ivermectin, which has evidence of good effect and is safe. It's been safe for 40 years, more than 40 years we've been using it. My point is, Washington, certainly the medical establishment, and I have to admit others, certainly the Department of Justice, have destroyed their credibility with the American people. And so the American people are sitting around, not just me, but I'm saying the average guy in the street who's starting to read all these articles about the side effects of the vaccines and going, why did I have to take this? Why did several thousand, well, I don't know, 100,000, but certainly tens of thousands of healthcare workers get fired because they refused to take the vaccine? Why did Navy SEALs get undeployable, I quote the military, because they refused to take the vaccines? Well, now we know we've been sold a bill of goods. And so I am afraid, and here's my sort of end point, I am really afraid that they have destroyed their credibility. And so the next time they say something that might actually, CDC especially, CDC and FDA, they say something that actually is true medically, we're not going to believe them. The people aren't going to believe them because, hey, fool me once, shame on me, on you. Fool me twice, shame on me. You know, you can only cry wolf a number of times, and then we begin to say, no, there's no wolf.
So that was going to be my next question is, you know, given what happened and the, I think, loss of credibility with a lot of players in the medical establishment, and who knows? I mean, you know, we hadn't had a pandemic in 100 years, and theoretically, hopefully, we'll be another 100 years or even more before we have to deal with another pandemic. But I do think that a lot of people in the political establishment would love to see the kind of power that they were able to wield during COVID come into their laps yet again. I think climate is the one that people have really fixated on as being the next likely possibility. So, but on the other hand, people are going to be a lot more skeptical of that. And, you know, we're going to get into the nitty gritty of the way the system functions itself. And I know this is kind of it's getting your crystal ball out, but do you think that this skepticism is, broadly speaking, healthy given the incentives at play in the system, or do you think we're going to suffer from shorter life expectancy and some diseases and other things that could have been prevented that we would otherwise not be?
Two-part answer to that question. Sadly, sure. I am not optimistic about this. They have lost, you lose credibility once, you cannot get it back. I hate to say this, it depresses me beyond words, but because there are a lot of good people at the ground level of the CDC and probably the FDA, although I don't know that. I know there are a lot of good people at the ground level of the FBI and the DOJ, but all of these have lost credibility. And once you lose that credibility, that trust, I don't think you can ever get it back. And so, frankly, if you wanted what I think should be done, literally, I think the CDC should be abandoned and a new agency with new leadership and new people created. Is that going to happen? I don't think there's a hope in hell that that's going to happen. So I am concerned about that. Secondly, you asked about life expectancy and access to timely health care and so forth. Unless we get a groundswell and change the fundamental system, the doctor shortage, which is already critical, is going to be basically causing people to die. people who could be saved. I shouldn't get personal. The fact is, you know that my wife died recently. She died of pancreatic cancer. She started having abdominal complaints almost 3 years ago. It took her 7 months to get in to see the doctor.
Yeah.
Okay.
Yeah.
That's not, I mean, of course, that's my tragedy and our tragedy, but that's not unique. You ask people, you look at any survey, and you're looking at months to get in to see the doctor. And then the doctor's got 30 seconds to actually talk to you, because he or she's got to fill out all these forms and all these compliance things, and dealing with the insurance bureaucracy, which is a nightmare. And by the way, anybody who says single payer is going to solve the insurance administrative burden has never worked in a government agency, because all you got to do is take a look at the VA to see how they handle their process. Caused, and I quote an internal review, 47,000 veterans died waiting for technically available care that they couldn't get in time. So death by queue, which I'm really worried about and pushing, and nobody's talking about except a few of us, it's going to get really bad. We're not going to have the care. We, the people, are not going to get the care that they need in time.
Yeah. Well, let's talk about that real quick. In the last legislative session here in New Mexico, and I totally understand if you weren't looking at things that were happening here, but we can pull the lens out a little bit to the national picture. There is clearly, or has been, a medical provider shortage here in New Mexico.
Yes.
They did some things to address that, addressing the threshold for lawsuits and the caps on those. There's also gross receipts tax adjustment to eliminate deductible and copay gross receipts taxes. There was some money poured into the system with all this oil and gas money that we can pay Medicaid providers at a higher rate. So those things should help here in New Mexico. But my understanding is that the medical provider shortage is not limited to New Mexico. It may be greater here than in other places. But what are you seeing with regard to the medical provider shortage, kind of on a national basis?
It is bad. It is really bad. It is especially bad in rural areas. I'm now in Texas. There are well over 10,000 towns in this state with no medical care in the immediate vicinity, literally no medical care. So there's no hospital, there's no urgent care. You're going to have to drive, assuming the roads are passable, given the weather and so forth. You have to drive a long distance in order to actually see anybody who's got medical training. The answer to your question is the shortage of access to care, the shortage of nurse practitioners and doctors is acute, and it's going to get worse. However, I have at least a small inkling of good news. More and more doctors are saying, to hell with this whole system. We're going to a direct pay model. And when you're in a direct pay model and you no longer have the government telling you what to do and the insurance company not paying you, or paying you 2 years, 3 years later, and you have time for the patients. And I can't tell you how many articles I've read of people in direct pay practices. By the way, it's not just medical, it's also, there are surgical practices of direct pay, and I can go into great detail because I'm obviously a big fan of this, where there's no third party between the patient and the doctor. And that is the solution to our whole problem. And more doctors are saying, hey, I can make this work. And I've seen other people who make this work. And that's not just good for the doctors, that's good for the patients.
Well, I definitely want to talk a little bit about that systemic kind of reform of the system. But before we get into something that would truly revolutionize the system, and obviously replacing a lot of government and insurance company coverage can be done on a small scale individual basis. What are some of the low-hanging fruits, ways that the American medical system could address the provider shortage? Do you think we should fund more residencies? Is that something that is a bottleneck?
I've got to argue with you. Forgive me.
Okay.
That is, we have been trying at least 50 odd years to get at least an increment, the low-hanging fruit. Well, what if we do this? What if we give more money to residencies for primary care doctors? Well, here's a little problem. Sure, you can give more money for residencies, but where are the experienced senior doctors to train them? They're all leaving. They're all quitting, retiring early. So you can even have money for residencies, but if you don't have the people to teach the residents, then they're not going to get the training and experience that they need to be good, safe doctors. So I'm going to argue this. The patient, namely healthcare, has cancer. I've been saying that over and over, and it's deadly true. The bureaucracy has taken over the entire system, so that the bureaucracy is stealing the money and controlling the care. We need to get rid of that. And so rather than giving a little more money to residencies, or reducing the gross receipts tax, or even working on licensure across state lines, which is another big problem, for example, for telehealth. And don't let me forget, we got to talk about AI at some point. The fact is, we need radical treatment of the system. And the radical treatment, in my mind, is actually very simple. It is political dynamite, and well, hell, it's a political nuclear explosion. Imagine this. Imagine that instead of the employer getting the tax advantage of the money that the employer gives to the insurance company, which is, by the way, for the average American family, $24,000 to $25,000 of compensation that the employee did not get, that the employer gave to the insurance company. And for a healthy family, that's literally money that was given to the insurance company that you got no value from, you got no benefit from, because you're still paying these copays and deductibles and so forth. Having said that, what if we simply said, okay, instead of giving that money to the insurance company, we're going to give it to the employee tax advantage, and he or she, they will put it in a medical savings account. Unlimited medical, you can put as much money as you want in there, but you're going to put in that 24,000 into there, and you go take care and shop for your own care and just buy catastrophic, high deductible catastrophic insurance. Literally, that will solve the problems of healthcare, and suddenly you will have doctors who have time for patients, doctors who want to see patients day after tomorrow instead of 6 months from now. It's a very simple fix of getting the third party out of the doctor's chair.
And I'll plug a recent article that you wrote on that for thefederalist.com. The title was "In Healthcare, Freedom is the Biggest Shortage," March 17th, 2023. So your writing appears in a number of different publications, and this really dives into that particular issue. And I totally agree with you. I think that is the long-term solution that will address the healthcare situation. But boy, the Democrats in Washington certainly show no interest in it. The Republicans, they really can't get out of their own way and come up with a coherent strategy. And I totally agree further, because what you're talking about largely re-empowers individuals and families and patients to use their own dollars more effectively in the healthcare system, to decide what they want to do and how they want to do it. But isn't that contrary to the interests of that system and everything that we've kind of seen over the last 3+ years? It seems like COVID was in many ways the apotheosis of the way we've been moving towards greater and greater totalitarianism and centralized control in not just healthcare, but especially in healthcare, and that COVID kind of hit that peak. Maybe we'll come back from it, but boy, I'd love to see your solution implemented.
Well, you brought up that article, and I really want to give a push, not to the article, but to the idea, which is people seem to have, most Americans still believe that our country was founded on freedom. The highest value, the number one issue for the foundation of the United States of America was personal freedom. Now, think about anybody's freedom to make a medical decision. The law says that we have medical autonomy. That is, the only person who can decide for me is me. Yet the system has taken away that medical autonomy, and we no longer, you, me, your wife, your children, those decisions are being made in a central body by mandates handed down from Washington. Doctor, pediatrician, so-and-so, you can do this, and you should vaccinate Paul's children, because that's what we say, even though the data says you shouldn't do that. B, the doctor, who's actually hopefully competent and good, says no, there's no data that's a wise thing to do. Yet your freedom, my freedom as a patient, my freedom as a physician to make decisions has been taken away by the system. So what I'm saying is medical autonomy, medical freedom has been taken away from us. And I want to make sure that every American understands that that's the way the system is working. And they have to stand up and say, no, I want to decide with my doctor's advice, not Fauci's mandates. I want to decide what to do for me or my grandmother or my children. And we don't have that now.
Exactly. All right. Well, I want to shift directions in the last several minutes of the show.
Sure.
We are, unfortunately, in the United States already talking about the presidential race in earnest, in terms of who will be elected in November of 2024. Candidates are pretty much all named, and we're heading into the primary season, which gets underway this winter. There's been a lot of talk, obviously, about COVID. I mean, Ron DeSantis in Florida really made his name to an extent with his COVID policy. Robert F. Kennedy Jr. has been very vocal, not just since COVID, but pre-COVID, on the issue of vaccines. Are there any of these candidates that you have a level of optimism about? Do you feel like partially or in a more broad context, they get it? Or where are we going with healthcare based on these candidates?
All right.
I know that's a big question.
Very important question. And unfortunately, I think fairly easy to answer. Everybody you named, we'll put Trump in a slightly separate category, but everybody you named, or everybody you can think of, whether it's RFK Jr., whether it's Tim Scott, whether it's Ron DeSantis, these are all politicians, and their resting pulse, their immediate reaction, their default position is, if we have a problem nationally, broadly, we should have a political solution to that problem. A new law doing this, or moving that money this way, or mandating X or Y or whatever, instead of saying, no, the root cause of the problem is our control, and the solution to that problem is withdrawing that control. So the only political solution that really will work is withdrawing political control. So long-winded answer to say, sadly, I don't think any of these politicians can or are willing to recognize that they need to get out of the way. And now we get to Trump for a second. Trump, being in certainly many people's mind the great disruptor, or at least he was thought to be the great disruptor. You got to read. Did you read Scott Atlas's book, A Plague Upon Our House? If you haven't, you really should read it. I say that to Paul. I say that to everybody, because there's a real kernel that answers your question, which is, Scott Atlas is a man that I respect highly, who really knows what the hell he's talking about, and is an expert in public policy, healthcare public policy, which, by the way, Fauci is not. And in his book, he describes how he would address to even Trump that the lockdowns were not necessary, that the vaccines are not being tested properly or tested at all, and all of the medical concerns that we have. However, his advisors, which basically were his family, kept saying to Trump, the political ramifications of your going against the medical establishment, Fauci and all these people, will lose you the election. And so you should not go this way that Scott Atlas advised him to go, which is basically the Great Barrington Declaration, which said, yeah, for those who are at high risk, vaccinate, or at least offer vaccination. For everybody else, don't do that. By the way, masks don't work. There are only about 150 studies, and I can quote at least 40 of them to you, that show that masks don't work. So all this stuff that they said to us was false, fabricated, etc. My point, to answer your question, is Trump himself, the great disruptor, got sucked into, well, the political downstream effects of my doing what's right medically will be bad for me politically, and so I didn't do it. So he didn't do it. And that's why I don't think anybody who is out there at the national level being considered or wanting to be a candidate, I don't think any of them will do what needs to be done.
All right. Well, I want to briefly revisit before we conclude Robert F. Kennedy, not because I think he agrees with either of us on the system, but he certainly has taken a strong kind of, if you want to call it the medical industrial complex, the successor in some ways to the military industrial complex of the Eisenhower, famous speech.
Yes.
Do you have any more nuanced thoughts about Kennedy, or do you think he's just more of the same ultimately?
I have listened to him actually several times, and I'm afraid he's ruining his own credibility. He says things that are medically absolutely right about COVID vaccines. Then he turns around and starts questioning other vaccines that we have 50, 70-year history of those vaccines. And he says, oh, well, they're dangerous and maybe we shouldn't use them. And respectfully, there is no data to back up that part of his position. And so I think he's shooting himself in the foot when he says that.
Okay, fair enough.
I actually like a lot of the things he's saying. And then he turns around and says something that's really kooky, and you go, wait a minute, where did that come from? So I think he needs to simply say what basically no politician seems to want to say is, here is the evidence that leads me to that conclusion. And let the people see that he has evidence that we can verify. You know, trust but verify. Well, I don't trust them anymore. I want to see their evidence. So if Fauci or RFK Jr. or look, Ron DeSantis, to his credit, had I don't know how to pronounce Ladapos, his medical advisor, Ron DeSantis, but I've listened to him talk several times. The guy knows what the hell he's talking about and presents evidence before he says anything. He's a good doctor, and DeSantis listened to him. So what I'm saying is, I want these politicians, whether it's on COVID or it's on economic policy or whatever it is, to say, this is the evidence. And I didn't cherry pick it. Here is objective evidence that led me to this position. And if RFK were to do that, I think he would be a very viable candidate. I'd like to see Tim Scott do that. I think he's great. That's just me personally. I just like his demeanor. That's the best I can do for you.
Fair enough. Well, how do we find your writing and information online, Dr. Deane?
80 years ago, when I was born, my mother put an E on the end of my name, Deane, and I've been paying for it ever since, because many people don't spell it right. As a matter of fact, I don't know, a couple of years before she died, my mother sent me a check and she spelled my name wrong. So, I mean, forgive me. Anyway, why am I saying this? Because my website is simply deanewaldman.com, but it's DEANE Waldman.com. And I implore anybody to go there or to go on Amazon and read Curing the Cancer in U.S. Healthcare. And the reason I want people to read that is because I wrote that book with the solution that I just gave you of how we can take back our medical autonomy. I wrote that book not for the politicians who have the power or the insurance companies who will lose big time if my solution is implemented. It's written for Mr. and Mrs. America, so that groundswell will turn around and say, wait a minute, I want to control my money and I want to control my medical decision-making, and that's called medical autonomy, and I demand it.
All right. Well, I appreciate your time today, Dr. Deane. We miss you here in New Mexico, but certainly understand your decision to move to Texas, and appreciate your candid remarks on that as well. Thanks for listening to this week's episode. Find all episodes at tippingpointsnm.com or at the Rio Grande Foundation's YouTube channel. Subscribe to the show at Apple, Stitcher, or tell Google Home to play Tipping Point New Mexico. Thanks to Path 3 Marketing for producing this show.